Hey y'all, it's me again. Welcome back to my channel. If you're new here, my name's Kirsten. I make videos mostly about dental assisting and then just like random things about life. And sometimes we have this beautiful girl who's special guest in my videos who's actually the star of the show. Today's video is going to be the pros and cons of dental assisting. I know there's some other videos on YouTube already like this. I searched pros and con videos and I didn't watch them because I didn't want to be like affected by what they say. And I also feel like some of the things I say that people might disagree with. So I wanted this to be completely from my point of view, my opinion, my experiences. These are going to be the pros and cons of dental assisting. So let's just get into the video. Okay, so I'm going to go through the pros first. I do feel like there's more pros than cons, but I feel like the cons weigh heavier than the pros. And I don't know if that makes any sense, but to me it does. So my first pro is that there's a lot of job growth in dental assisting. You know, it may not be exactly at the office that you're at, but there are so many offices with so much job growth, especially like bigger offices or corporations and stuff like that. Not only can you be a dental assistant, but you can be cross-trained to do front desk, and then maybe you can become an office manager or lead dental assistant. There's a lot of ways to grow within good dental companies. One of the offices that I was at for clinicals was a bigger office, and one of the girls, she didn't even go to school. She just got on the job trained. She started as a sterilization tech, and then she worked her way up to a dental assistant, and then she became lead dental assistant, and now she is the office manager. So it's definitely possible. All you have to do is work hard, and the opportunities are there for you to grow in knowledge and experiences and just be able to widen the list of things that you know how to do, which is always good. Especially say if you wanted to end up leaving the medical field or something like that, having all that having clerical and office manager type skills and stuff like that is valuable at a lot of different places. Another pro to dental assisting is the fact that if you do go to school for dental assisting, it's usually a shorter sort of program than a lot of other careers. So my program was 11 months long. It was 9 months of in the classroom and then 2 months of on-the-job training or internship sort of training and things like that. But so many assistants just get trained on the job, so you don't have to actually pay to go to school. You could find an office that is just willing to train you straight on the job. Thank you. I guess I need a bath. So the next pro is that there's a lot of job possibilities. So not only can there be a lot of job growth within your office, there's just a lot of different possibilities of jobs in the dental industry. So there's already a lot of different divisions of dentistry. There's general dentistry, orthodontics, endodontics, pedodontics, you got oral surgery, you got parodontics, I'm sure I'm missing something else. But there's so many different sort of niches that you can find, you know, a place where you feel like suits you best. You can also go into dental sales. You can work for multiple different sort of dental companies, you know, that sell stuff. So I know a couple assistants that have gone into sales. You could also go into instructing. I know people that have only been assistants for 5 years, possibly between 5 and 10 years. They applied to jobs to be dental assisting instructors, which, you know, if you have a family or anything like that, that's a pretty good job because at least the school that I went to, they followed the public school schedule. So our teachers were off when their kids were off and they really liked that. So there's so many options and different routes you can take, whether it's in your own office or outside of your office, doing numerous different things. So the next pro is the flexibility of offices, or the amount you can work, I would say. So there are offices that are open 2 days a week, 3 days a week, 4 days a week, 5 days a week, 6 days a week, whatever you need and the amount of hours you need, there's an office that is open that many days a week. I don't know how many hours they'll let you work, but you know, if you are a little bit older or if you are a mom and you have children, there are offices that are out there to fit your needs, and that's not the case for necessarily like every sort of like industry. I know medical tends to sometimes sway to like 4 to 5 days a week, but dental, there's literally offices that are like, I know for ortho, there are so many offices that are open 2, 3, 4 days a week. So there's something out there that can fit the needs of you and your family and your lifestyle, which is really nice. My last pro is that you get to work with people. And I know in dentistry sometimes, you know, you can struggle with dealing with patients, or some patients just aren't the happiest, but really like you see them get their new crown, their new veneers, they get their braces off. Like these people are genuinely so happy and so thankful. you know, that you just see them. They just got their new veneers or their new crown, and you give them the mirror and they smile, and you're just like, you can just see how genuinely happy they are and like so thankful that you were able to help them and feel better, make them feel better about themselves. So that's really rewarding, especially with braces, when you have like kids or adults come in and they get their braces off, and you've been with them through this whole like 1.5 to 2 year long process, and their braces come off, and they're literally, I've seen people, you know, get a little teary-eyed, and it's really awesome. I only have 3 cons written down for dental assisting as a career, and the first con would be bodily fluids. So it doesn't necessarily bother me that much, but there have been some situations where like I've been a little bit like stomach churning over some stuff going on in a patient's mouth, or just like a smell or anything like that. Especially dealing with general dentistry, you're dealing with teeth that are decayed or abscesses, which tend to have an odor and pus and ooze and things like that. And sometimes patients also gag, which leads to vomiting, and that's another, you know, thing to deal with. So if that's something that you aren't comfortable with, or, you know, you just know that you can't physically handle dealing with that, like it makes you nauseous or it kind of grosses you out a little bit, that's, you know, completely understandable. Like I've said, I can, for the most part, I'm pretty good about it, but I have had some queasy moments in the past, and yeah, that's all I'm gonna say about that. So my next con is that the risk for pain is pretty high. People might agree or disagree with me on this, but from what I've talked, like the people I've talked to and what I've gathered about like dealing with arthritis and back, neck, hand pain, sometimes like issues dealing with like balance and stuff like that, it's very real. In the short time that I've been a dental assistant, I've definitely felt pain in my neck and back and hands. It's, you know, something I really think about, because when I'm sitting in a chair, it's, you probably don't think I'm thinking about my posture or, you know, my ergonomics, but I am. I think about it so much. I'm like, straighten up, why does my back still hurt? Like, it happens. Sometimes you end up in weird positions more often than not, trying to get done what you need to get done. And I mean, it is really important to use your mirror and always, you know, try to have the best ergonomics that you can. But dealing with patients on a daily basis, doing it week for week, month for month, year for year, it adds up. And I have talked to so many people that have talked about the fact that they can't do dental assisting anymore. They've gone into instructing or sales, or, you know, just did clerical duties and stuff like that. Now, a lot of people continue to work through the pain, and a lot of people also just never really had any pain. And, you know, I think it honestly just depends person to person, and I don't think it's necessarily like one person's fault. I think all people in the dental field, well, not all people, but I feel like hygienists, assistants, and doctors, they all go through the same sort of type of pains, back and neck pains, and then like from doing small movements with your fingers and stuff like that. So if, you know, the way I look at it is, I don't know if I've definitely had to think about the long-term effects of this job, and, you know, it has definitely swayed me into considering switching careers, going back to school and stuff like that. So, you know, if you already have back or neck pain, it might be something to think about, or just like knowing that that's not something you want to deal with, I would definitely, you know, ask around, do some research. But yeah, that's all I have to say about that. So my last con is the pay. People might also disagree with me on this as well. I feel like for the amount of work you do and the amount of responsibilities that you have, I feel like, especially when you're just starting out, I feel like you are like extremely underpaid. And I know that you are brand new coming into the field for the most part, especially if like you're not into like a specialty, if you're just like in a pedo office or a general office and you're like just starting out, I feel like the pay is so low for how much effort and work and time you put into your office and your doctor and your patients and everything like that. And I know some assistants that make upwards of $20 to $30, but I feel like all of them have been assistants for like 15 years or 20 years, and I don't know if it's worth making $25 an hour in 10 years and my back and neck be completely shot. Like, I just can't, that just doesn't balance out to me. So yeah, I don't know. So guys, these are just my opinions, you know, don't take them too personally or anything like that. If you have any other pros or cons, leave them down below so other people can look at them and read them. I hope you guys enjoyed this video. So thank y'all so much for watching my video. I hope y'all enjoyed it. If you have any requests for any other type of videos, make sure you leave them down below. Don't forget to subscribe, like, and turn on your post notifications so you never miss when I post a video. I love you guys so much. Thank you for all your love and support. You guys are literally the best fam ever. And I'll see you in my next video. Bye.